Hi, this is Laborat Sherry. Today, let's talk about the top 10 most high yield blood bank scenarios in your MLS ASCP certification exam. So first, the acquired B phenomenon. What you're looking for is the forward anti-A is 4 plus and anti-B slightly at 1 plus, but reverse, you will get A1 cells at no reaction and B cells as a strong 4 plus. There is a little bit mismatch, and this is usually related to some bacterial infections like E. coli. When you see this, make sure you check the patient history. And the second scenario is subgroup discrepancy, the A2 type. The serology reaction, what you're looking for would be a strong positive anti-A at 4 plus and anti-B at nothing, and reverse. The A1 cells is reactive. 1 plus, sometimes people may give you a 2 plus, but as long as it's weaker than your B cells at 4 plus, then you're looking for this one. The third scenario is Rulo versus true agglutination. This one, you need to print it in your head because this is a multiple myeloma scenario. You will be getting this one, and your multiple myeloma patient would also maybe having some hematology related questions just cross over on your exam. For this type of patient, you are looking for a weak reaction across every single tube in the reverse typing. If you do a saline replacement, the Rulo will be disappear and the true agglutination will not. The fourth scenario is dosage effect. This one, you are looking at the antibody screen. You will have a positive reaction on cell 1 and a negative reaction on cell 2. And the most important antibody group you need to remember for this one, for dosage effect, are KIT, Duffy, and RH except D, MNS. Fifth scenario, the enzyme panel. This is not really that common in real life practice, but in your exam, they love it. I don't know why, don't ask about that part. If the exam asking you multiple allo antibody masking each other, and then you need to treat them with the enzyme panel, now the key things you need to remember is what antigens are destroyed by the enzyme and what are enhanced. The destroyed are MNS and Duffy, and the enhanced ones are RH, KIT, and Lewis. 6. The cold auto antibody mask or anti-I. This one is everything positive at the immediate spin stage. The two keywords you need to remember of this scenario are IgM, auto antibody, and mycoplasma pneumonia infection. Don't mix this up with the acquired B. The acquired B is caused by the bacterial enzyme modify the patient's type A sugar. The modified structure is mimicking a B type. And the 7th scenario, we finish the cold autoantibody. Now we come to the warm autoantibody. This one is a positive DAT. Every single panel cell is positive at 3 plus at the AHG phase. Auto control is also positive here. And this one, the antibody class is important. Again, don't mix it up with the cold one. This antibody class in warm autoantibody is IgG. ASCP loves to trick you how you treat them. You have two options. One is auto absorption, and another one is allo absorption. The auto absorption, AUTO, this auto, it is only happening when your patient does not have a recent transfusion history. How recent? 3 months, because 3 months the red cells will be dead off. Unfortunately, you have to do some memorizations on this scenario, but I assure you, you will thank yourself by doing that because ASCP will test you on this one. And the next one is the ROGAM eligibility. You need to remember 2 tests and 1 equation. ROSET, and KB. Remember, go back to your class note, find the equation, and make sure you remember that equation correctly. It's not a complicated calculation, so don't lose point on that one. Now comes to the ninth scenario. This one is acute hemolytic transfusion reaction. This one is very, very common to see. It also has a crossover questions with the laboratory management section. This one is fatal. It's happening with ABO mismatch. Patient would be having as minimum as 10-15 mL of transfusion and having really severe immediate reaction to it. Fever, chills, pain, hypotension, all that horrible things you can think about. Post-reaction blood draw will give you a positive DAT. Now, finally, the last one is respiratory. This one you have two scenarios. One is trolley, another one is taco. Huge difference is the taco is a volume overload. So if you want to differentiate these two, you're looking at body time and blood pressure. This is the easiest way to differentiate these two. Both of taco and trolley scenario has a pretty high chance to having laboratory management exam material crossover on your question. All right, this is the top 10 most high yield blood bank scenarios on ASCP exam. Study hard. Good luck with your exam. This is Library Cherry. I'll be seeing you next week.